Everyone, it's great to be back with the Flint Community Webinar, your community resource, every Friday at noon. Today, again, we are a partnership between Michigan State University and the Healthy Flint Research Coordinating Center. It's so great to be back here with you all. And we've got a really great panel here today of really great experts. We're going to start today with Tricia Hill, Deputy Superintendent at Genesee Intermediate School District. We've got McKenna Holman, who's coming to talk to us from the Genesee County Health Department with Dr. Kaylee Blaney, and Tamara Brickley, who's going to talk to us a little bit more about health in the community with Genesee Community Health Department. So we've got a packed schedule of really great experts, and we're really excited to bring them to you today. We're going to start off a little bit talking to Tricia Hill, Deputy Superintendent with Genesee Intermediate School District. We're really great and excited to have you here. Tell us a little bit about what's going on in school systems around RSV and COVID. We've talked a little bit about a lot of these respiratory viruses and how they've affected kids in hospitals and adults. Tell us a little bit about what's going on in schools.
Sure. Good afternoon, and thanks for having me today. I will say we are definitely seeing an uptick and a surge in the RSV, especially with our younger kids. We have programs in our schools all throughout the county that start serving children at 6 weeks of age to kindergarten entry. So that age group of students are really seeing the RSV virus. We're taking precautions in our classroom when children are sick, and disinfecting, of course, and educating parents on what to do and following up with their primary care physician. But we're definitely seeing that uptick, and then all the way through in our elementary schools as well with that respiratory virus. So we're not far behind from what you're seeing in the state and the country as well. With COVID, we are seeing a slight decrease in cases, and that continues to be the case for us with our programs at the Genesee ISD, which is good. We track our student numbers, of course, and report, and then our staff numbers as well. Both of those populations are seeing a decrease, so that's good news as well. And I think you also wanted me to touch on mental health. We are seeing an increase in need with all of our student populations, from our youngest students to our high school students and our students with special needs. Continues to see an increase of need in that area, and the severity of the need has increased as well. So our staff is spending a lot of time with students and trying to connect them with resources in our counties, and then with families as well. We've created some great partnerships with GHS and trying to hire our own internal staff with social workers and interventionists to help really assist in the classroom, but then also assist families with making those connections. So that need is great.
I imagine that need is really expansive, especially as we get into the holidays and you think about not being able to necessarily reach your students over the holiday break. I want to talk about all of these things a little bit more, if you don't mind.
Sure.
So what happens in the schools when a kid comes home or is diagnosed with RSV? What are we doing? You know, what's the policy in terms of, okay, you've got to stay home, or, no, you can come back? How does that work?
That's really a complicated question, unfortunately, and it depends honestly on our program. But first of all, if we have a nurse connected to that program, that's the best situation. So they can support that family with making sure the little one gets to the doctor, and then connecting with that family on, was it a true diagnosis? And then what does the doctor say about a return to school? And then checking in with that family along the way, making sure that they're staying on track with their medications and the child is getting better. And if not, again, providing guidance and resource to connect back with that pediatrician. So that would be the best case scenario. In a situation where we may not have a nurse available, it could be a trained office personnel or a family engagement advocate trying to really do that same thing. And it's just all about staying connected in that diagnosis and when they can safely return to school.
That's super helpful. I think as a parent myself, you want to make sure you're in line with what the school guidelines are, and you want to make sure you're not getting other people sick, and
Yeah.
you don't want their teachers getting sick and other people getting sick.
Yeah.
If you had advice to parents as like a first point of contact, kids sick, you think it's RSV or COVID, who would you tell them to contact at their schools? Or
contact the school office. They're either
okay.
gonna, if it's that secretary that answers the phone, they'll connect them if they do have a nurse. And we're always gonna follow the guidelines from the health department about fever and communicable diseases, whether we know it's RSV or not. So all office staff are trained on what those protocols are, and they can then give that advice to the families on that return to school.
That's fantastic. Thank you so much. And we'll be following up with the health department and having them talk a little bit about what their guidelines are. So that's a really nice segue. As we think about mental health concerns, what do you think is maybe driving some of these mental health concerns? Do you think some of it has to do with this? We've had these COVID surges over the last couple of years. Maybe there's something else. Do you have any thoughts on kind of?
I mean, anecdotally, of course, I think it's multifaceted that students were away from a structured environment. Again, depending on their school and their age for quite some time. So I think that delayed intervention. It also, they weren't in a structured environment to help with some of those interventions as well. And I think families are under a lot of stress for a lot of different reasons. The economy, food prices, gas prices, jobs, it just is a different dynamic. You mentioned the holidays right now. Historically, that is a factor. Kids are nervous about going home for whatever reason. So again, I think those would be our responses. They're multifaceted. I think COVID definitely had an impact, just with being away from intervention, away from structure, and away from any diagnosis, and with delays. So we're really working on putting supports in place for kids as we see them, trying to reach out to families and connect them as well. But it's an issue that all schools are dealing with.
You mentioned either children being kind of nervous about the holidays and some of the resources that you provide. And I appreciate you mentioning that, because oftentimes I don't think we look at schools as being such an infrastructure in our society that they may be, right? So schools provide that structured environment. For many children, it might be providing their source of meals, right?
Yes.
And it might be providing that source of support. When you think about what you're seeing in terms of this rise in mental health needs, how does that present in children? And I guess if I would be asking you, what should people be looking out for when they think, okay, do I need to be touching base with my school? Is this a mental health concern that's popping up?
It really can present differently in children, but it could look like oppositional behavior. It could look like, in your younger ones, temper tantrums, crying. It could be withdrawing in your older, high school kids or middle school age. So just really any behavior that is atypical for your child. I do think for parents that don't know, maybe in the community, what resources, go to your school first. Okay. If they don't have any other place to go, and then that person, whether it's a counselor, a social worker, administration, can maybe help make those connections, because we have such great resources in our community.
Yeah, absolutely. Can you talk to us a little bit about that? What are there resources in the community that you connect families with regularly when you notice these mental health concerns pop up?
Yeah, again, depending on the need, but we work regularly with GHS. I mean, they've been incredible with their mobile services, putting individuals in our buildings across the county to help make that connection for families easier. Easter Seals is a great resource. I don't want to leave anybody out, but we have several connections and partnerships with agencies across the county.
That's wonderful. And we are always, I feel like, on this webinar at risk of leaving someone out, because we've got such a rich community that's always dedicated and doing all they can. So it's really wonderful to hear about some of those partnerships. Are there any last kind of comments that you'd like to give to the community as they think about, we're going into the holidays and we think about school-age children, what needs there might be or resources that you all provide that you want to mention?
Yeah, I think it's just if we all take care of each other, and if you see a child or a family that might be struggling, don't hesitate to reach out to the GISD or your local school district. It may not be their family, but we can help put you in connection with the right people that could reach out to them for support, because we have a lot of resources. So don't hesitate to reach out on behalf of a child or a family.
Trisha, I so appreciate all of your expertise and your support. And I want to ask and hope that maybe you'll be willing, or your team will be willing, to come talk to us, monthly or as frequently as you can. I know we've talked to you about maybe talking about vaping and some of the things that are going on in the community around that, and getting some resources and education in the community about that. So we really appreciate your support and your time today, and we appreciate the Genesee Intermediate School District.
Thank you. We appreciate you as well.
All right, good to talk to you. So Trisha gave us so much great information about the partnerships that she and Genesee Intermediate School District have created and cultivated around making sure our little kids, our kids, are getting resources that they need. She talked a lot about the health department and all of the resources that they've helped provided. And I'm going to ask Kaylee Blaney, Dr. Blaney, to come talk to us a little bit about the resources in the community and talk to us about the health department. And I think you're going to take over emceeing a little bit of this for us and talk about what the health department is doing.
Yeah, sure. Thanks, Dr. Edwards Johnson. I do want to say as well, we have a great relationship with GISD. They are fantastic partners in making sure that we are able to get the information to the schools, to the charter schools, to the private schools that we need to get out, especially when we need to get it out in a timely fashion. So we do work very closely with GISD, especially when there are a lot of illnesses going around. Right now, there's so many things going on. You've got a measles outbreak in Ohio that obviously we're monitoring very closely. You've got RSV in children right now. You've got flu circulating. We still are dealing with COVID. And then, in the greater world, when you're talking about what's going on disease-wise, there's large cholera outbreaks going on. There's an Ebola outbreak in Africa. So there's a lot of disease news that the health department needs to sift through to determine, what is the most immediate needs of our community. Obviously, things going on abroad that haven't spread abroad have not spread to the US yet. So those are things that we monitor, but don't necessarily put information out until it's something that the community needs to know about right now. But things like RSV and adenovirus, and making sure that you stay home when you're sick, to not promote getting other individuals sick. Because one of the things that is really challenging for the schools is they have to have enough teachers to operate, talking about school operations. School districts have pools of substitute teachers, but when you have 50% of your teachers out sick, you can't operate schools safely. And that's something that is a real challenge for our school districts when we do start to see a lot of illness, is that if you get a lot of teachers sick at one time, it's very hard to deliver instruction to students. And it's also very difficult when you have more than half of a classroom out with illness, because you have half of the kids home sick and you have half of the kids in school. But then when those half come back, all of a sudden they're behind all of their classmates. So there's a lot of unique challenges when it comes to operating school districts and trying to educate children when you have a lot of illness going around.
And Kaylee, I appreciated you mentioning how many different illnesses and sort of locally, right? In my office today, flu, influenza, and flu is influenza, both A and B we're seeing, and RSV, right? Lower COVID, kind of like Trisha was mentioning in her pool. But I just want to encourage people, we've been really COVID centric and we've been a little bit RSV centric, and we're hearing about that in kids. But get in to see your primary care doc, get in and figure out what it might be, because we're seeing flu and circulation as well. So I won't take up any more of your time, Dr. Blaney.
No, you're fine. And at this time of year, one we always want to mention as well is norovirus. We see a lot of norovirus this time of year, which To not be too descriptive, it genuinely is when it's coming out both ends. It's not fun. So, when you have illnesses like that, again, so important to stay home, and especially with norovirus, hand washing is essential. Hand washing is absolutely essential. Norovirus survives well on surfaces, so it's relatively easy to transmit. So just making sure that you're watching out for those things. And I do want to make sure that we transition to our next speaker. It's a good time to talk about how do we prevent these illnesses? And one of the ways, we have illnesses that we can't prevent. We know that RSV vaccine is on the horizon, which is something that's really exciting. And that I hope that vaccine is approved soon for use in both children and older adults. But vaccines are pivotally important in preventing the illnesses that we can prevent, that we have the ability to prevent. So I do want to introduce one of our wonderful health educators. Her name is McKenna Holman. She started out with our COVID-19 unit, and she now has transitioned into working mostly with our immunizations unit and our local providers on increasing vaccine uptake in their populations, making sure that we're checking to see what immunizations children need, but also making sure that we're talking to adults about what they might be behind on and what they need to be updated on. So I'm very excited to turn it over to our wonderful health educator, McKenna Holman.
Hi, thank you so much for that lovely introduction, Dr. Blaney. And I do have a presentation, so I am going to attempt to share my screen and share that presentation so we can get started. Let's see, just hold on with me for a moment. Hopefully everyone can see that. So as long as we are good, I'm going to get started. So like Dr. Keeley said, my name is McKenna Holman, and I am the immunizations health educator for Genesee County Health Department. And today I wanted to talk to you about the impact of vaccinations. So specifically, I'll go over Michigan's vaccination coverage rates, the recommended vaccine schedule, and what vaccines are required to attend school. I'll also go into the impact that vaccinations have had over the years, including information about the increasing vaccination hesitancy that we've been seeing a lot lately. Lastly, I'll give an update on the number of vaccine preventable disease cases in Michigan and updated information about the most recent measles case in Columbus, Ohio that we were just talking about. And lastly, what our next steps should be. So once I am finished with my presentation, I will hope that you've learned about the importance and the necessity of vaccinations in all stages of life. I want you to be able to know how to be familiar with what vaccines are needed at what point in life, and how to give a strong vaccine recommendation to your family, your friends, and others around you. So let's begin. So Michigan ranks 26th out of 50 states for vaccine coverage levels. And with the trends we've been noticing, I think it's probably going to drop down the list. We need to understand why our coverage rates are dropping and figure out how we can stop this trend. About 1.5 million people a year still lose their lives to diseases that could have been prevented by vaccination. So overall, when you see in this chart, for the primary childhood vaccine series, which is that 19 to 36-month-old, that covers 4 doses of DTaP, which is diphtheria, tetanus, and pertussis, 3 doses of polio, 1 dose of MMR, which is measles, mumps, rubella, 3 doses of hepatitis B, 3 doses of HIV, which is a type of influenza, 1 dose of varicella, which is chickenpox, and 4 doses of pneumococcal conjugate, which is a type of pneumonia. And all of that has dropped in the past 4 years by 8%. So looking at the other side of the table for those 13 to 14-year-olds, for the adolescent vaccines, which includes the 1 dose of Tdap, which is tetanus, diphtheria, pertussis, 3 doses of polio, 2 of measles, mumps, rubella, 3 of hepatitis B, 2 of chickenpox, and 1 of meningococcal, which helps prevent against the meningitis. All of that has also decreased in the last 5 years in Michigan. So with our coverage level rates for all of our vaccinations decreasing, we can only expect Michigan to drop further down on this list. So what we have been doing in trying to promote vaccinations, unfortunately, is not working at this time. So there are about 28 different vaccinations that are available in the US at this time, but not all of them are required to go to school. So different vaccinations are required for different age groups. So vaccinations that are required for all students starting in daycare and continuing on through their education. There is this really big gap between kindergarten and 7th grade where these kids do not need any types of vaccinations because they're just not eligible. The last time they get a vaccination is around 4 to 6 years old, and that's when they get like their last polio and their last like measles, mumps, rubella, their last chicken pox, their last DTaP, and then when they turn 11, that's when they're eligible for their first Tdap vaccine, which is a little different than DTaP because it has a little bit more tetanus in the vaccine to protect these kids. And then this is when they're also eligible for their first meningitis vaccine because you got to be 11. So these vaccines are required for schools, and if a parent chooses not to get their child vaccinated on time, they are required to get a waiver for each of these grade markers, and that can only be supplied by the health department. And funny enough, I'm actually the person who supplies all of the vaccination waivers for the health department. So these parents will make an appointment, come in with me, I try and educate, try and identify misinformation that they may received from anyone, from just social media, family and friends, and even their doctors. Hopefully I try and convince them to get vaccinated. And if not, I know at the end of the day, they've gotten the proper education about vaccinations. And for adults, there are no vaccinations that are really required, of course, unless you're a medical professional. They're only recommended. So for adults ages 18 to 49, it's recommended that you get your annual flu shot, you're up to date on your HPV vaccine. 10 years after you get that Tdap vaccine, around that 7th grade, you do get another one. And then you get another tetanus vaccine booster every 10 years. And of course, I'd really love everyone to be fully updated for all of these vaccinations, especially the flu, because we're kind of experiencing a very bad flu season this year. So I just want everyone to be protected as most as possible. And then we kind of transition to those 50-year-olds. So that's when they're eligible for their shingles vaccine. So this is if you were got chickenpox when you were younger, you have the shingles virus in you. And 1 of 3 people who have the shingles virus in you will end up having shingles. So if you do have this vaccination when you're 50 and older, hopefully that will decrease the chance of you getting shingles later in life. And then you're also eligible for the pneumococcal, which helps prevent a type of pneumonia in older adults. So let's move to talking about the impact of vaccinations. So vaccinations continue to save 2 to 3 million lives every single year. Life-saving vaccines have drastically increased the longevity for Americans. Today, Americans are living twice as long as they did a century ago. And I gotta say, it's really because of public health and all of our efforts. And by 2030, it's estimated that the measles vaccine will save nearly 19 million lives, and the hepatitis B vaccine can save 14 million lives. And since 1988, more than 18 million people can walk today who otherwise would have been paralyzed. And 1.5 million deaths have been prevented, and that's all thanks to the polio vaccine. So each of these vaccines have saved millions of lives every single year, and they have saved millions of lives from suffering from these illnesses and from premature deaths. Many vaccines like polio, smallpox, chickenpox, mumps, and measles have actually seen a 98 to 100% decrease in cases. So due to vaccinations, the CDC estimates that the vaccinations of children born between 1994 and 2018, so actually someone like myself who was born in 1997, the US has saved nearly $406 billion in direct medical costs and $1.88 trillion in societal costs. So if there is a measles outbreak in a state, it would actually cost the state an estimated $1.3 million to investigate, control, and maintain that outbreak. So just flu and pneumococcal disease, shingles, and whooping cough alone cost $27 billion to treat each year in adults just over 50 and older for 4 diseases that could be prevented by vaccines. So for reference, none of these costs include the amounts that are incurred by private insurance or the indirect costs paid by individuals due to lost days of work or ongoing care, or include any money that we all save from getting the COVID vaccine. So for many of these vaccine preventable diseases, suffering can come back later in life. For example, many individuals who are diagnosed with polio and survive experience paralytic symptoms later in life from post-polio syndrome, or how 1 in 3 individuals who had chickenpox will be diagnosed with shingles. So despite the fact that vaccinations can save lives, money, and suffering, vaccinations have been a big topic of controversy since vaccines were first officially created by Edward Jenner in the 1790s, starting with the smallpox vaccine. So famously in 1721, Benjamin Franklin and his brothers actually criticized variolation, which is a technique used to inoculate a person against smallpox. In 1736, smallpox rapidly invaded Philadelphia, where Ben Franklin and his family were staying, which eventually killed his 4-year-old son. Later, Franklin wrote in his autobiography, "I lost one of my sons by the smallpox. I long regretted bitterly and still regret that I have not given to it by inoculation. This I mention for the sake of the parents who admit that operation and the supposition that they should never forgive themselves if a child died under it. My example showing that the regret may be the same either way and that therefore the safe should be chosen." So he's pretty much saying that he regrets not vaccinating his child because it, in the long run, of course, would have been safer and would have saved his son. So despite Benjamin Franklin's warnings and experience, vaccine hesitancy continues on. So we jump to 1905 when Pastor Jacobson refused to get smallpox vaccination for himself and his child, and also refused to pay the $5 fine. So he took it to the Supreme Court. And the Supreme Court rejected Jacobson and wrote that vaccines are good and they're for the good and the welfare of the Commonwealth because the community has a right to protect itself against the epidemic of disease which threatens the safety of its members. We're moving on again into 1982 when there was a point in the timeline of US vaccine history for hesitancy. In 1982, there was a document called DPT Vaccine Roulette, and DPT is diphtheria, pertussis, and tetanus. And that documentary emphasized the risk of vaccines while ignoring the disease. So this documentary was not done by scientists, it was done by a reporter. And the reporter claimed that the combination vaccine was imbalanced and inaccurate. So despite later on the CDC and the American Academy of Pediatrics later telling the community that there's nothing to be worried about, and this vaccine is really safe, the damage was too late. So many of these parents already saw this documentary and were convinced that these vaccines cause seizures, learning problems, and brain damage in their children. And vaccine hesitancy hit yet again in 1998 when a doctor published a case series that suggested that the MMR vaccine caused behavioral regression, which caused vaccination rates to drop. And almost immediately after this published case series was out in the open, the doctors actually retracted their statements and said there was actually no causal link whatsoever. And they actually posted it because they were given money by a group of lawyers who were trying to sue pharmaceutical companies just to get a bunch of money. So these doctors were bought out. So Dr. Wakefield and some other doctors actually lost their medical license, but again, the damage was too late. And unfortunately, this caused a sharp decline in measles coverage, which allowed numerous and dangerous measles outbreaks to occur between 2000 and 2018, and unfortunately now in 2022. And this leads us right into the hesitancy towards COVID-19 vaccines, which we are all too familiar talking about. So I'm gonna go on to the next slide. So due to these hesitancies, we actually have been experiencing a sharp increase in vaccination waivers. So this data is only from Genesee County, which I work in. I did not get any data from Michigan, but it is very safe to assume that this data accurately reflects other counties in Michigan. So this vaccine waivers allow parents to avoid getting their children vaccinated for all of these vaccines that I talked about in the previous slides. So just about in the past 7-8 years, the numbers of waivers have actually doubled, and they really don't show any signs of slowing down. So you're supposed to get a waiver at the very first day of school, otherwise you could potentially be kicked out of school. And even today, parents are still trying to get waivers for their children like 3-4 months later. So just one kid with measles or chickenpox and they go into school, this could quickly turn into an outbreak situation due to having a really high number of kids in the same class that aren't vaccinated for measles or chickenpox either. So I want to focus on what we can do next due to there being vaccine preventable diseases in Michigan. So there are cases of vaccine preventable diseases in Michigan. Although they have decreased during the pandemic, this year we've seen an increase in the amount of cases. So this picture you see here is a child with measles or with chickenpox. So some of you may have seen chickenpox, may have even had it yourselves. Thanks to the vaccine, I nor any of my friends have ever gotten chickenpox, and I have never even seen chickenpox in my life. But that might not always be the case, as there are already 221 cases of chickenpox in Michigan just this year. So Michigan isn't the only state with cases of vaccine preventable diseases. There's actually an outbreak of measles in Columbus, Ohio that first started on October 22nd. The case numbers are still growing. There was a peak at November 21st with 7 cases, and although it has dropped, their case numbers are still trying to trickle in. There were even cases just being added yesterday. So these cases are mainly affecting 18 years and under, and all of these cases are unfortunately all unvaccinated or have 1 dose of the measles, mumps, rubella vaccine. So the majority of these cases are young. 93% are 5 years and younger, not 1 case over 18 and older, and it doesn't favor one sex over the other. So 93% of these cases are 5 years and younger, and not 1 case is over the age of 18. So we need to focus on making sure our children are vaccinated. So 93% of these cases are unvaccinated, and only 5% or just 4 people have only 1 dose of measles, mumps, rubella, and that's not enough to protect them. This is a serious outbreak case, and we've seen actually a 40% hospitalization rate versus a usually expected 20% hospitalization rate. It's probably because these children, who the majority are under 5, could have, not been properly hydrated. They're not eating, because you can't make a sick kid who's like 1 year old, drink a bunch of water, drink their Pedialyte, eat their toast and applesauce, because they just don't want to. Unfortunately, this is affecting 18 years and under, and the majority of these kids could have been vaccinated. You need to be at least 1 year old to be vaccinated for the measles, mumps, rubella vaccine. So a lot of these kids could have been protected. And unfortunately, Ohio is not the only case with the measles outbreak going on right at the exact same moment as this. Our other Midwest neighbor in Minnesota actually has an outbreak of their own too. They already have 22 cases, and they are also experiencing a high rate of hospitalization. Their hospitalization rate is actually at 40% as well. So how do we protect ourselves? So the Genesee County Health Department and I have started an immunization action coalition, which consists of physicians, hospitals, pharmaceutical companies, schools, urgent cares, and other passionate members of the community that want to work together to increase our coverage rates, as Genesee County is unfortunately in the bottom 10 to 15 percentile for coverage rates in Michigan. But we're the 5th largest county, so that's not good. We need to work better. So hopefully by working together, the county will see a real improvement in our county and state's coverage rates. So moving on, what can you do? 1, you can get vaccinated. Make sure that you're up to date on your vaccinations and get your yearly flu shot. Not only are you protecting yourselves, but others, as well as because you won't be able to spread it to anyone. Next, talk about vaccines with your family and friends. Ensure that they have the right information and aren't accidentally consuming misinformation, which make them vaccine hesitant. And lastly, join our coalition if you're in Genesee County. This is especially important if you plan on getting into the medical field in your career, because you'll be confident in the education you'll be providing to your patients, and you'll know how to encourage vaccines to vaccine-hesitant parents. And if you're not in Genesee County, see if your own county has a health coalition or an action group that is passionate about vaccinations. And if your county doesn't have this, come join ours anyway. We want to make a difference not only in our county, but also in our state, because it's not like we only stay in our county our whole lives. We're very like to go travel over the holidays, go see friends and family, go to concerts, festivals, all the fun things. So I want you to get vaccinated, post on social media about vaccines, talk about it at family Christmas and all your holidays. And I want you to take action. So I wanted to thank you for allowing to talk to you guys and talk your ear off about the importance of vaccinations. And I hope you learned a little bit something. So if you guys do have any questions, please let me know. I love as many questions as possible. Email me, call me, text me. I am here to help you guide along your immunization journey.
Thank you so much, McKenna, for your presentation. And I think, you touched on a lot of important points. And I think one of the things that is most difficult when we talk about things like measles, measles as a vaccine is 98 to 99% effective. So we know that it's an incredibly effective vaccine. We know that it is a safe vaccine. So I know it's continually difficult to deal with outbreaks. I know I worked on the outbreak in Oakland County, and I'm one of the only people in the state who has seen measles. And I can honestly say it was horrifying how sick people were. When people come out and say it's just a routine childhood illness, it's not. A 40% hospitalization rate is not a routine childhood illness. And one of the things that I think is important for us as the health department to talk about is what would a measles outbreak look like in our community. And I know that I've worked very closely with McKenna. We're trying to prepare for that actuality and making sure that our providers know that you should not be doing a blood test for measles. You should be doing a throat swab so that we can confirm that it is measles. We shouldn't be using site diagnosis. We have these things at our fingertips. We have a wonderful state laboratory who is able to do that testing. Not every state has that. So one thing that I would like to share with everybody, just so that if you need something for talking points about how important this is and how important vaccination is, there is a project out of the University of Pittsburgh. It's called FRED. What FRED does is FRED simulates what outbreaks would look like in different communities based on different vaccination rates and what illness is introduced in the community. So I'm actually going to share my screen with you guys just for a moment. And if you go to this website, which Heather Lynn will shortly put in the chat, you can press play. So for example, on the left is 80% immunization coverage. On the right is 95% immunization coverage for measles. And if you press play, on the left, it will show what will happen if one case of measles is introduced in Flint. It shows what the anticipated case spread of those cases would be over the course of several weeks. And as you can see, at 80% coverage, there would be a significant amount of cases in our community that would last several months. And as McKenna noted, these outbreaks are very expensive to respond to. Whereas if you look at the chart on the right, at 95% coverage, if a case is introduced, there's going to be a lot less cases and there's going to be a lot less response because we have what we call herd immunity. So this website is something that you can use depending on how you need to discuss things with people, or even for preparedness planning or anything that you might be doing. It's important to be able to show people tangibly what this could look like and what the health impact or the familial impact or the time off of work impact would look like for families in our community. So another thing that I briefly wanted to talk about, and this is a question for McKenna. I know she's still here. Just to talk a little bit about what are the long-term impacts of measles? What are the things that when an infection is over, how do these affect kids? I know measles impacts pregnant women. So just McKenna, if you can talk a little bit about what the long-term impacts of measles would be in our community, that would be great.
Yeah, so what you mentioned, that it actually affects pregnant women. So because the measles, mumps, rubella vaccine is a live vaccine, if you are not previously vaccinated for the MMR vaccine and you are pregnant, you cannot get the vaccine at all during your pregnancy. So that does leave you open to the disease and to the effects of measles. And unfortunately, this can severely impact your fetus and your fetus's life. So it could impact physical, your physical body. It can impact cognitive issues. You would need lifelong care possibly for your infant. And this is also the same for chickenpox as well, because chickenpox is also a live vaccination. So that is something that you do need to think about if you ever do want to get pregnant, of course, because that can lead to devastating effects to your fetus. And also for all of these kids who are getting measles, I mean, they have the trauma of getting a vaccine preventable disease. So I don't know, they could possibly have PTSD. They could feel bad that they maybe transferred it to their best friend. Maybe they transferred it to their grandma who, got a vaccine way back in the 60s and maybe didn't get their second MMR vaccine. And maybe grandma's in the hospital and has a lot of complications. Or maybe this 7-year-old who got measles transferred it to their baby sister, and the baby sister's in the hospital, and they could feel this immense sort of guilt. So we want to prevent all of this. We want to prevent all of these kids from going to the doctor, being scared by measles, hopefully not getting PTSD from getting such an awful disease, and preventing deaths in their close family and their friends, not showing it in all of their school. I mean, you don't want to be the kid that spread measles to their entire school for the rest of your life. That's kind of embarrassing.
Yeah, so kind of speaking a little bit on the same vein of, working to protect children and giving children, the things that they need and trying to set them up for success. This is a good segue to transition to our next presenter from the health department, Tamara Bricky. She is our division director over our health education and our maternal child health programs. We wanted to bring her today to talk a little bit about, we talk about childhood vaccines and how making sure that a child is healthy is super important to them, being able to stay in school, making sure that, they have better health outcomes in the long run, things like making sure that they reach high school graduation, making sure that they're not developing illnesses that can affect their cognitive ability or their ability to simply stay in school, to make sure that they're gaining the knowledge that they want to have. So Tamara is going to speak a little bit today about our Healthy Start program, which is a program that helps our moms and our families in Genesee County to try and have the best outcomes that they can have. So I will turn it over to our division director, Tamara Bricky.
Hi, good afternoon, everyone. I am very excited to be able to present about our Genesee County Healthy Start program. Healthy Start is a program that is near and dear to my heart. I began working on Healthy Start actually in 2012 at the Ingham County Health Department. Healthy Start is a federally funded initiative all across the country. It was actually a bipartisan effort to reduce infant mortality in high-risk communities. The biggest measure of how healthy a community is how healthy are our babies. So Healthy Start really was an initiative during the first Bush administration to lower rates of infant mortality throughout the United States. So I have a little presentation to give. And I just want to say, McKenna, your presentation was fantastic. And I was like, oh no, my PowerPoint doesn't look nearly as nice, but that's okay. I'm really glad that you put that presentation together. So I'm going to go ahead and do a screen share here. I believe this is the right screen to share. Oh, no, hang on, let me.
Nope, looks good.
I think that was my note version, so I think this is the one that I need to share. Is that correct?
Looks good.
All right, awesome. So I want to share with you all our Healthy Start program. We have had Healthy Start in this community since the late 90s. We brought it here at the Genesee County Health Department in the early 2000s. So I hope that many of you have heard of Healthy Start, but that being said, I want to make sure that we get to talk a little bit about what Healthy Start is, because a lot of people get it confused with Head Start or whatnot. So let me go ahead. So what is Genesee County Healthy Start? So our Healthy Start program is a maternal child infant health initiative, essentially here in Genesee County, meant to work with families that might be at high risk, unfortunately, for negative health outcomes for their infants. We work really closely with the MIHP programs in Genesee County. MIHP, for anyone who doesn't know, is the Maternal Infant Health Program. You can kind of think of Healthy Start as a bonus program that enhances MIHP programs here in Michigan. So our Healthy Start program, the core of our program provides home visiting services for expectant and parenting moms and dads. I really want to stress that, dads as well, of children who are up to 18 months old. So you might have heard of other programs like Nurse Family Partnership. I love Nurse Family Partnership. I think it has a wonderful model. Healthy Start really kind of focuses on families that are, I would say, significantly at risk. And Nurse Family Partnership, sees families who they're experiencing their first pregnancy. And I think that's wonderful, and to have that coaching there is great. But we know that some families, even second or third pregnancy, et cetera, might need, that support as well, depending on where they are in their lives right now. So we are happy and proud that Healthy Start can serve families, regardless of if this is first pregnancy or, if this is third pregnancy or fourth pregnancy. We're able to meet families kind of where they are. Every family is going to have a different experience with every child, and we're happy to be able to serve them. So we have families that, this is their first time in the program, and we have families that this is maybe their second or third time in the program as well. We work with a group of nurses, social workers, dietitians, community health workers, health educators, et cetera. We work all as a team to make sure that we can provide services in home for our families. So, you might have a client that you encounter, a parent that you encounter that maybe heard of this program, but they're like, what does this mean? What does it mean that someone's actually going to come into my home? So we work with nurses at Ascension at Home and Hurley Medical Center, and then as well as our own health department staff, our community health workers. Their names are Misty and Veronica, and they're absolutely fabulous. But they all work together in a cohesive team to really provide what this family might need. So we provide pregnancy and infant education. I think that is really important because, as a new mom, a new dad might have anxiety about what to expect during this pregnancy, especially if they've had a negative pregnancy outcome before. To be able to be teamed with a group like this who can sit in their home with them, sit on their couch with them, and kind of explain, what they should expect during the next stage of pregnancy, to be able to answer some questions that they might have about, symptoms that they're feeling right now in their pregnancy. We want that to be, an experience that makes parents feel empowered and makes them feel like they are really taking the lead on their medical care during and after pregnancy. So we can do many different things besides provide education. We can assist our clients with doctor's appointments. It's really, really important for, our postnatal moms to get that first appointment after they've delivered their child. And oftentimes once baby comes, everyone's attention is on baby, which is super important, but also to have a healthy baby, we got to make sure that mom's healthy too. So that's one of the things our staff do as well, is assist making sure that our clients are able to make those appointments and get those appointments scheduled. We can help them with transportation if that's an issue. We can help coach them through a call with their physician if they need that type of assistance. We really try to be an advocate in that way. We also provide nutrition information. I think, the water crisis really highlighted for us the importance of good nutrition for children, good nutrition during pregnancy, and during that, postnatal time, and hopefully being able to educate families about the importance of pregnancy spacing, also in turn being able to, stress the importance of good nutrition, for mom and baby in particular, because, if you plan to have any future pregnancies, your nutrition now could influence the outcome of a future pregnancy as well. So we have registered dietitians through our contracts with Ascension and Hurley, who actually can provide in-home nutrition education and assistance as well. We also work really hard to get families connected with WIC. If they qualify for our program, we know that they also qualify for the WIC program as well. So we try to help them with that as well. And luckily, WIC is a program here at the Genesee County Health Department. So our staff on Healthy Start work very closely with our WIC staff as well. So, that's a pretty smooth referral that can be made for WIC. We have families that need housing assistance. Our community health workers are fantastic in helping. I heard a story just yesterday from our community health workers about a single mother who, she had housing, but she didn't have any way of furnishing her home. And they worked with different community partners, Catholic Charities, et cetera, to help this woman, just get some basics for her home, make sure that the baby has a safe place to sleep, making sure, that she, has a couch to sit on and things like that. So, little things that maybe seem like, well, why are you guys helping with that? I thought you're talking about pregnancy. But when it comes to the different stressors that families are carrying with them, these things are important. So, again, just making sure that general needs were being met. Our community health workers were able to do that. So, when I say housing assistance and also connection to additional community resources, those are the type of things that I'm talking about. I think we all know, working in this community, that there are a lot of tangible needs that unfortunately are not being met for our families. And our community health workers really work with every community partner you can think of to try to ease some of the stressors that our families are experiencing. So is Healthy Start only a home visiting service? And I had to squeeze in a cute little picture of toddlers because I always want to remember what our program is for. And our program is to see healthy, thriving little chubby babies. That is our goal always. We want to see those pictures of, the moms and the dads and their happy smiling toddler. That is something that, makes our day every time we see that image from our families. But I just want to let you know too that the home visiting service, while it is a big core component of what we do, we also have, so much more with Healthy Start as well. Actually, we had asked our Healthy Start coordinator, Taria Fagan, to do this presentation today, but she's unable to attend because they're doing a holiday party right now as we speak for our Healthy Start families. So I was able to kind of jump in a pinch and go ahead and give this presentation on her behalf. But we do provide parenting classes. We provide peer support groups. That is actually the Christmas party that we're doing right now is for our peer support group. Just families that are currently enrolled in Healthy Start, have been enrolled in Healthy Start, And they're able to come together. And I think that that is such an incredibly important part of Healthy Start. Especially when I worked in Lansing. And I actually got to work more hands-on with the program versus kind of overseeing the program. I got to work with a parent group of Healthy Start families, and I had moms, I had grandmas, I had, the aunts that was very involved, I had dads be a part of the program. And just that fellowship that they were able to experience with one another. It was so wonderful to see families that lived right down the block from each other, but didn't really know each other now come together. Now they, were able to have play dates with their kids together. They found someone who's having similar experiences that now they can call up on the phone and chat with, hearing about, oh, we took the kids to the movies together, things like that. This support that is able to, happen because of our Healthy Start program is really, really important. And I definitely think while we're discussing mental health in the community, we need to definitely highlight the importance of these types of social connections. So that being said, I've talked about Healthy Start really is a program for families. I did this slide, planning to segue to Sean Hart, but unfortunately he won't be able to be here, but I will talk a little bit about the services that his organization is able to provide as well. The work that we do, even this federal funding, it goes under the umbrella of maternal infant health programs. And that's important, but we also have to remember that dad is a very important and crucial partner in all of this. We cannot talk about healthy moms and healthy babies without talking about healthy dads as well. Even our WIC program, as wonderful as it is, and dads definitely benefit from WIC as well. The title is off-putting. The title is Women, Infant, Children. So while we do a wonderful and very needed, necessary job of focusing on women's health and making priorities for pregnant women, we have to also understand that we need to support dad. When we're talking about, again, mental health, and we're talking about the importance of, these social connections, we cannot exclude dad and other family members as well. So one of the wonderful components of Healthy Start is that we have a fatherhood program. So fathers and supportive male figures, that could be uncle, that could be grandpa, can receive father-focused services and individual coaching. And that's where Sean Hart comes in. We contract with Sean Hart and his Involved Dad organization to really help provide mentoring and coaching services for our dads. He gets together fatherhood groups. And again, just like I mentioned, the importance of those, parenting groups for moms, it's also important for dads to have an outlet where they can talk with their peers as well and realize that, hey, some of the experiences I'm having, some of the anxieties I'm having of being a dad is not unique to me. And we also know with men's mental health, it really is quite hard for men to open up often about what they're experiencing and how they're experiencing it. So being able to bring a fellowship of men together is really important. And while I think this work is super important, I'm not a man, and I know that there's just a way that I cannot connect to men. So we are so very grateful for Chuck and Sean and his team, his teammate Chuck, who's now a part of the program as well, to bring in our dads and be able to provide that support and that coaching as well. So for anyone who's looking to connect a client, you can call us directly. You can also check out our website under our health programs. We do have Healthy Start listed. Our phone number is there. And as well, even if you don't have our direct number for Healthy Start, feel free to call the Genesee County Health Department and we will get you connected. We can make that referral very easily. Families can self-refer as well.
Thank you so much, Tamara. And Dr. Edwards-Johnson, I'm going to throw it back to you to wrap everything up.
I appreciate it. I appreciate you, Tamara. I appreciate you, Dr. Blaney. We don't have much to wrap up on. We are going to take a bit of a holiday break, and we will be seeing you in the new year and on January 6th. Again, our constant reminder for social workers trying to get those continuing education credits. Here's your information that you need. So thank you much for your attention and happy holidays. We're excited to see you next year.